Let's look now at the thoracic cage, sometimes referred to as the bony thorax. It consists of the sternum, also referred to as the breastbone, the costa or ribs, and technically the thoracic vertebrae to which the ribs articulate or form a joint with. However, in this discussion, we're not going to talk about the vertebrae because we've already talked about them. You have 12 ribs, regardless if you are male or female. The first 7 ribs articulate directly with the sternum through what's called costal cartilage. We have cartilage articulating with the sternum rather than bone to give some movement and flexibility here so the chest can expand as you inhale. These first 7 that articulate directly with the sternum are referred to as true ribs. Ribs 8, 9, and 10, notice they have costal cartilage that doesn't articulate directly with the sternum, but instead they sort of all merge together, and then they sort of merge or fuse with the costal cartilage of rib number 7. So we refer to them as false ribs. Notice that ribs 11 and 12 don't articulate with anything on the anterior side. And so we refer to them as floating ribs. Now, technically, they are also known as false ribs. However, if I ask you what type of rib is this or this, 11 or 12, I'm not looking for false ribs. I'm looking for floating ribs. And that's the only thing I will accept. Are they technically false ribs? Yes. But what I'm looking for is you to know that these are floating ribs. Now let's look at the sternum. So this bone here is called the sternum. It has 3 bone features that you need to know. The manubrium here is the superiormost portion, sort of looks like a men's necktie. The middle portion here is simply known as the body. And this inferior portion, which sometimes resembles a arrowhead, is known as the xiphoid process, and that is xiphoid with an X, not a Z. Before we end our discussion on the thoracic cage, let's look at an individual rib. And for simplicity's sake, let's take a true rib. So this true rib is going to articulate on the anterior side with the sternum, and it's going to articulate on the posterior side with a thoracic vertebra. Let's take a look at the major features of a true rib. The end of the rib here that is sort of wedge-shaped and articulates upon the lateral surface of 2 adjacent thoracic vertebrae is simply referred to as the head. Posterior to the head is a slightly narrower neck. Here where the rib articulates upon the transverse processes of the vertebral foramen is a little knob-shaped area which we refer to as the tubercle. Here where the rib angles sharply forward, we simply refer to as the angle, and the bulk of the rib here that extends all the way to the sternum where it articulates with the sternum via the costal cartilage, that is referred simply as the shaft.